I'm Praxis Valadez. I'm a co-founder and head of growth and partnerships at Principal Practice Management Software, cloud-based PMS for dentists in Australia and New Zealand. Really interested in modernizing the dental space and creating a product that is feature-driven, workflow-driven, to essentially, like everyone says, make the dentist and the practice's day better, right?
Yeah, 100%. I think a lot of the things that we try to push from our business perspective is building that trust with content, video, photography, and then we'll bring the patient in. But once they're in, if there's not a good PMS in place, then those patients will just kind of leave, or there won't be the retention there, right? So
yeah, absolutely. Patient retention is the name of the game, right? That's what everyone's talking about, that, and how do we make sure that the patient care is consistent. To be honest, when Principal decided to become a thing, when we decided to be a business, we took it very seriously in that we're not going to be a practice management software that copies something that's already existing. How do you take the problem that dentists and practices are experiencing, which really is patient retention? No one wants to come to the dentist ever, right? No one ever wants to be there. And yet we have this problem of needing them to continue to come back. So how do we take that problem and spin it on its head and think about what are solutions that we can implement that go beyond making sure the diary is full, or making sure that we offer them water when they walk in? Like, there's got to be more to it. And for us, it became about how do we create workflows for the folks that are working at the practice, and how do we automate as much of the workflow as possible so that essentially the nuts and bolts background work is done for you.
Yep.
And then the staff go, I can actually care whether or not this patient likes water or tea or coffee, and I might remember to like greet them by name, because I can now focus on the things that are more meaningful to the patient versus making sure I write down a task, making sure that I listen to what the dentist is saying as they're walking out with one patient and another patient is coming in. We're all about the workflows. We're all about ensuring that tasks are automated, lab jobs are tracked, that emails and SMSs go out magically, automatically, without one having to think about it. And it's all connected to treatment, so we can personalize as much as we can, while like having that basis of it's a treatment. You're always going to want to do a TLC phone call after an extraction. Let's automate that. You know, let's figure it out together. So that's, I think, our huge point of difference.
Right. And how often do you find that a dentist will be very traditional with their approach? So when you're going to approach a dentist, are there still dentists that just use sort of spreadsheets or like very kind of archaic ways of bringing in the patients and recording them without naming names?
I won't call it worst case scenario, because honestly, at the end of the day, if they're treating their patients and the patients leave with a happy smile, we're all good. True. Right? Yeah. But I would say truly Australia, for whatever reason, feels a little bit like, I don't want to say behind, but a little bit behind. We're trying to say, guys, like, we need to modernize the industry. We need to push forward. Yep. And so, yes, a lot of the demos that we take, a lot of the people we speak to are folks that it's something's ticked over in their mind, that they're like, wait, I should be doing better, or I'm working too hard to be doing this. Like, it's too many spreadsheets. It's too much paper. It's too much manual work, right? And we're finding too, patients are still coming in and they expect more out of you. Like, this generation, like, for whatever it is in these last like 5-10 years, we want more from the people that service us, right? And so now you're doing more, and you're having to remember more and feel and give and love on more, but you still have the same like tools that are quite heavy and intense. So we're like, how do we shift that? What can we do to help that? Where can we save time? Where can we make it more efficient? Where can we have less clicks? All of that. And with Principal, you can send them an SMS and an email, kind of in a campaign style, with the timings of how you'd like it. First thing Monday morning at 9 a.m. The next one goes off 1 week later. The next one goes off 3 days after that. However, and designed to your branding and your style. And it's important that you go, I just pulled a report one time. This is the information I need the one time, but it actually will refresh it every day, or every half a day if you wanted, to make sure that new people are entering the campaign and start that sequence of messaging. So it's very like hands off, but you're getting like bang for your buck, really, because you're just sending out messages and people are flowing through, people are coming in.
And it's a much better way to approach a patient through like a text and get their response, you know, straight away, because they're looking at it, right?
I think it's important that the software that you're using at your practice supports what's going on in the modern everyday real world, which is people are not picking up your phone call. Everyone's afraid to do that. So your receptionists are wasting time calling.
Yeah.
They are. I'm sorry to say it, you know, and maybe they leave a voicemail, but eventually it goes down to that text message anyways.
Yep, 100%. Yeah. Well, we did a video shoot in the past where it was like a full day in a studio where we filmed all these frequently asked questions that a dentist always gets asked. So, you know, think of your top 10 questions, and we filmed it in a really nice way, really aesthetic. And that's actually what they used in those texts. So more from a post-treatment perspective. So let's say, you know, someone got a full arch implant done, and then they needed to know, you know, how to look after the surgery site. Sure, the dentist explains it, but they've been able to automate that video asset using the software, and then that goes off to the patient. It's all automated. The power of that is so much bigger, like in 2026 and now, than some of the sort of more traditional ways. Like, you just can't beat that, in my opinion.
That's exactly what I'm talking about. That's exactly it. It needs to be automatically sent off to your patient the moment that they check out, or 5 minutes after they leave the practice. And doing that, one, great for the patient, great experience for them. Two, great for the receptionist, who no longer has to remember to do it. Right? All of those conversations that we have, particularly early on when we first started talking to dentists, like, where's the pain, where's the problem? Like, we take that stuff really seriously. And then as we have gotten now more and more customers, and we're in like such this beautiful place of like rhythm, we still take the feedback of our customers really seriously. You know, we create features that benefit them directly because they've asked for it directly, you know, and it could be one person saying, I think this will benefit the whole, and we take that seriously. Or it could be a bunch of customers saying, actually, we need this tiny thing that maybe, you know, they wanted like a little icon. We didn't think of icon. Like maybe 7 practices were like, we need this icon. We're like, okay, we'll make the icon. That sounds great. You know?
So you actually really do think about the patient as well, not just the dentist. Obviously, you got to think about both, but you really think about, okay, what is that patient thinking from the second that they're attracted to, you know, 5 years on?
Has to be.
Yeah,
it has to be. But the way that we can help the patient is through the dentist and the practice managers and the staff on the ground. If they're happy, if they're confident that the software is working for them, they can essentially give that patient care that everyone's concerned about.
And I love your point before about creating a practice like where a lot of patients are expecting more. And I think now a lot of the top practices in Australia and even in the UK and the US in the dental space is that it is like an experience. It's like walking into an Apple store. It's like walking into like a 5-star hotel or something like that. It doesn't feel like a clinical dental clinic where it's all, you know, green and white and no, you can't.
It is changing. I think people are very precious with the money that they're spending. And if you're in a country like Australia where, you know, you don't get a lot of government funding to pay for your dental procedures, depending on what it is, of course, like you're going to want to go to the best feeling practice that you can, the most premium, the most beautiful, right?
100%.
It's the one with the best service. That's
and
that's what I recommend to your mom and your sister, and you know.
What's the biggest mistake you'd see practices make when switching sort of systems from something else to another, to your PMS, for example?
I think a lot of people are shopping around, and it's interesting what their list of like most important things are. For me, I think a big mistake is if you're not taking your like data integrity seriously. That when you're going from one PMS to another, that the data as you see it in the new PMS is recognizable and understandable as the data that you're used to in your old PMS.
Right. Yeah.
It can't change. It can't go from a square to a circle. It has to stay square to square, if you know what I mean. People need to be able to recognize, like, this is what the information that I need, because no matter what PMS you're jumping over to, there's always a hurdle to learn. It's change management. No one wants to learn a new software. I mean, back in our days when Facebook used to change every year or so, people would be pissed, right?
Yeah, that's it.
It's the same thing. When you change software, you're like having to learn a whole new way to move your mouse or to look for something, even if it's a better option. At least if the data is as you recognize it and as full as what it was in the old one, that's a good place to start, because then you can trust that your experience is going to be great.
Yeah. And for the principal dentists out there who might be a little bit worried about getting their team on board, how easy is it?
Oh, honestly, I mean, training is so important to us. We promote training as an important part of the onboarding process.
Yeah.
And so we ensure that the team has something similar, like a Google Meets, because everyone's everywhere. So within Australia, but everywhere.
Yeah,
and
for
so
sure.
we all like to make everyone's time efficient. Let's jump on a Google Meet and let's do a training as if you're in a webinar, you know? And so you do your training very hands-on. Everyone has their own like demo or dummy space to work with. We give that to them to use outside of training to practice. Our best launches, our best practices go, this is your homework, guys. You have to take it seriously. And if we find that a dentist, an owner, is leading from the front, leading that change to say, guys, we've made the decision to leave the old PMS for principal. This is training that we're going to do. We have to take it seriously.
Yeah.
Those guys are flying.
Yeah.
You know, they're flying so happy.